Hi there. Today I'm going to demonstrate or know a bit about class 4 laser treatment for verruca or warts, whatever terminology, if you want to use it, and wherever you are in the world. So there's two types of procedures. I am going to explain it to you or show you. Both of them are without local anesthetic. So we're going to use certain tips. There's no technical name for it. One, I would say surgical tips. Another tips, it's vaporization. It sends a beam and it basically vaporates the tissue. Again, there's no technical name. I call it one surgical and one fungal tips or vaporization tips. Right. So this one is, I call it as a vaporization tips. So it's a small, you attach it to the Remy laser attachment. It's also got a guide, so you don't more or less go near the skin so much. So that beam will shine through that to vaporize the tissue. So this is, I call it a non-touch. The touch one, what I say a surgical, it's this, right? This is attached with sterilized needle, but it's a laser type of needles because laser shine through. You will attach it and then I call that as a touch. So you will touch, touch, touch. This is for as non-anesthetic but there are process on the vaporization and there are also process for the surgical tips. Both of them I have tried it and is quite effective. It all depends on the practitioners and how they use the dose, and mainly you have to assess the patient whether they are suitable for class 4 laser treatment. So with the laser treatment, one thing is best to have in handy is a fume extractor. It's quite portable and it will take the fume or suck in the fume. It's much better. It's really portable machine and it's not that expensive. So, and it does extend the arm, so you can go exactly where you want to extract the fume from. We're going to use Remy. Remy is class 4 advanced 30 watts. Currently I am using 30 watts. We got quad watts as well, but I am going to use a 30 watts. And with that, there's a many way to cool the skin as well. Remember, it's a non-anesthetic, or there is no local anesthetic given to the patient. So I sometimes use called cool pack, instant ice pack, right? Or in United Kingdom we have called tip therma, right? Is to test the sensation hot and cold of diabetic foot. So you can use, this is quite cool area, so you can put that into freezer or fridge, again whichever terminology you are using, and that tip, it's iron more or less, or metal, so it's quite cool. And with instant ice pack, right, there's an instruction there. Once you break it, it will give you that cooling sensation. You also would require alcohol wipe or antibacterial wipe. So when you vaporize the tissue or do a touch verruca treatment or lesion treatment, you will first put the ice on for a few seconds, then you can use the procedure, whether touch or non-touch, and then you wipe it with wipe. Either it's alcohol wipe or hand sanitizer, any wipe. So what it does, it slightly dampen and you will have less fume. So remember that. You'll have less fume if it's slightly wet a bit. So I hope I have explained the procedure as much as I can. Another thing I would be using is eyeliner. That is where where there is a lesion of verruca, I'm going to put, just going to highlight the area, because laser penetrate dark circle, right? That's the purpose of it, just to penetrate that circle, and it's safe as well, right? So basically eyeliner. So it's just, as I said, the light will go through and vaporize that area we will mark. Thank you very much. And as I said, I will show a video of the procedure and you would see it. Wet it a bit so it's less smoke. So this one is the mother one. There, that's it. Okay, and then we got another one there. So just one touch and then that's it, stop. Then one touch, then stop. Okay, so we go back again in here, one stop, we stop, and then we ice it a bit. That. Yeah, I think that's much better for you. Yeah, I'm also finding this is useful. Yeah, that's all right, because I'm touching your skin.